Welcome to this video from the Public Health online course by EFNet in partnership with Diffusion. Today we're going to start with a case. In a country, the treatment of all tuberculosis patients is free. Patients are expected to show to the nearest healthcare center to receive the treatment under direct supervision. Dots. The health center keeps a record of which patient had which dose. The tuberculosis officer in that region of Contrastan noted that one of his patients, Mr. Contagious, did not receive his doses in the last couple of weeks. Accordingly, the officer approached Mr. Contagious to persuade him to take the doses on time. The patient refused. The officer presented an official request to the Attorney General in that region saying that Mr. Contagious presents danger to the public. The Attorney General issued an order of arrest against Mr. Contagious for the whole duration of the tuberculosis treatment. This is the case. What do you think? For the officer, for the patients? Many impressions that I guess had come to your mind about the officer and about the patient. We're going to scrutinize them a little bit later. But let's have a look at this statement. He killed her. What are your impressions about him and about her? Him. He should be the bad guy. He's the killer. What about her? Probably the victim. Oh, and here comes a history of men killing women, men abusing women, and it goes on and on. Many ideas could be in your mind at this point of time. Impressions, first impressions, and feelings. Probably, if you stop at this level, you may act in a different way. But let's see what is the truth. Oops, it was me, the killer. It was her, the Aedes aegypti, the female Aedes aegypti. It was our first enemy where I was working in dengue fever control program in one of the countries in the region. So this was the enemy. Did it change your impressions about he killed her statement? I hope it did. Now it's me. Now we know who killed her, but why, and what happened in which circumstances. Let's back to the case. Did you have any of these initial thoughts, or perhaps feelings, about that the tuberculosis officer was wrong? Sending the patient to jail was not fair? Keeping records of the patients in healthcare center is dangerous thing, and it goes on and on and on. Stop. Don't act on these gut feelings or first impressions. Bioethics is on the way. How could this help? Let's have a look. We will start with ethical or moral reasoning. How does it work? What is it, and how does it help us to resolve the ethical issues? It is a process that we need to go through to reach a decision about an ethical issue. It helps us to differentiate between the facts and the values. Fact is simply the description of the way the word is, what is going on. So it's not enough to say that he killed her. We need to know who is the he, who is the one being killed, and the reason and the facts on what happened. This goes also with the tuberculosis case. Then it comes to the values. What are the values in place? It's more or less what we think how the word ought to be or should be. Then there are ethical principles which are meant to guide our actions at the personal level and at the professional level. There are many principles that we can find in different disciplines of bioethics. For example, there's the principle of respect of autonomy for the patients or the people in general. There are principles of justice, there are principles of reciprocity, the solidarity, and many other principles that we're going to go through later on in this course. So, what is ethics? This is a key question. A system of moral principles or standards governing conduct. A system of principles by which human actions are judged as good or bad, right or wrong. Set of rules or standards governing the conduct of a particular class of human action or profession, like us as public health practitioners. Any set of moral principles or values recognized by a particular religion, belief, or philosophy, as we will come in a few slides. Now let's come to the bioethics. Bioethics As its name implies, it is a bio, which means like the living or life, the ethics, as we've just defined it. So bioethics is a branch of ethics applied to the decision-making and public policy in the domains of biology, healthcare, and research. There are three keywords in bioethics. It helps us in identification, analysis, and resolution of ethical issues. It has many domains, as we can imagine, like clinical ethics, also called medical ethics, also the research ethics, but our focus indeed is on the public health ethics, which we'll define as the identification, the analysis, and the resolution of ethical problems arising in public health practice, research, and policy. It is also concerned with the concepts, values, aims, and methods and arguments arising in different aspects of public health, service, practice, research, and policy. How bioethics works. As we said, we have three keywords: to identify, to analyze, and to resolve. How does it work? Well, in terms of identification, it answers the two key questions. Is it an ethical issue? How to define an ethical issue? Then, after we are kind of sure that this is an ethical issue, then how to analyze it? Bioethics helps us by differentiating facts, values, and principles. Again, it helps us by providing frameworks for ethical analysis, which will come later in this course. In terms of resolution, it's usually done through a group of experts known as committees, which could be either clinical committees or research ethics committees, as well as providing guidelines and policies. So, the key messages that we need to conclude this part of the course that public health has the potential to produce public good, but also wide-scale harms. Public health ethics help us to maximize the benefits and minimize the harms. Public health ethics help us to maintain the most important aspect of our field, which is the public trust in the health authorities and the healthcare system as well. This is the list of readings and references that I hope that you go through before watching the next video. In the next video, we're talking about the ethical principles and theories and the core public health values. Thanks for watching and see you next video.